abduction, okay? You're gonna start them in the supine position, alrighty? Now, depending on the table you're gonna have, okay, and the size of the person here, you may need to sort of move them over to one side of the table, alrighty? So can you do me a favor and move over this way? We're gonna, oh, hold on. I'm gonna need, I can still do it, okay. Alright, could you put as over as you can. Now, do you wanna put your leg right here to make you sort of stabilize yourself?
Sure.
Yeah, okay. Now lay down. Okay. Alrighty, make this leg straight. Alrighty? Because if you look at it, alrighty, if I had it in the middle, 45 degrees, where's the lower leg gonna be?
Over the table.
Over the table. People don't like that, okay? Alrighty? If they're hanging over your arm, they feel a little bit better because they're just a little bit more comfortable. Alrighty? So that's why you're gonna move them over to one side of the plinth. Alright? And you're gonna use, and we'll have a chair for you during the practical, alrighty, to support themselves. Okay? So I'm gonna be measuring on her right leg, okay? Now looking at her landmarks here, for her moving arm, okay, you're gonna be lining up with the midline of the femur, using the patella as the guideline, okay? Alrighty? Her stationary arm, alrighty, is gonna be across to the other pelvi, or the inanimate, alrighty? And you're gonna use your ASIS as the fulcrum. So your proximal arm is gonna be lined up this way to the other ASIS. Yes or no? Okay? So I'm gonna find her ASIS, and she's easy. She's right there, and they're all both lined up. Alrighty, so I'm gonna move over to the other side now. Alright, I'll stand over here if you need me. Alrighty, so I'm just gonna drop this down a little bit. Is that good for you? Okay. Alrighty, so I'm gonna have it here. Alright, her goniometer. Alright, so while we're here, can I see you just sort of slide your leg out towards the side? Okay. Alright, now bring it back in. Good. Alright, good. Alrighty, now, some people, depending on the person, you may want to take the heel off the bed just in case. Alrighty, if it's shearing too much, because you guys are learning about wounds right now, so that's okay. Alright, what do you want to look out for real quickly? That she doesn't cheat or anything like that.
Externally rotate.
Externally rotate. Most people like to do this as soon as they're laying down. Alright, try not to do that. Make sure their toes are pointing straight up towards the ceiling. Alrighty. Most people don't do anything with the trunk because it's already stabilized, right? The plinth is stabilizing it, so the trunk should be okay. The only thing that they may do, right, is they might sort of lift up a little bit if they're that weak. They'll try to lift up a little bit on the contralateral side and twist a little bit, right, to try to force the leg to go a little bit more, right? But more the compensation or substitution is going to be looking at the lower extremity itself. Alright, so I'm going to line her up. There's your ASIS. And the fact is, wherever she happens to put her leg, that's my starting position. So can she possibly be starting in an adducted position? Yeah, can she start in an abducted position? Right? So you're going to sort of play with that a little bit and looking at the range itself. When we're looking at the range, yes or no? Okay.
Quick question. Where do you want the leg to be in line with the shoulder?
In line with the shoulder? Whatever she happens to put herself in. Right? I mean, the fact is, some people, especially arthritic people, right, they may be adducted. Right? Not much I can do about that because if they're very severely arthritic, they're going to have a hard time just getting in that position. Right? And the other extremity may be abducted to compensate for the arthritis changes. So you're going to start whatever position she's in. And you're going to look at it, is she more in line in an adducted position or an abducted position? Okay? Right. So she's here, I'll stand over here. Alright, so you guys can see. Alrighty, now. Alright, so, okay. Alright, am I in the way? Can you get it? Okay. Alright. Alright, so she's lined up. You can see that it's in the midline of the patella. Okay, alrighty. Looking at the femur midline patella, going right across, okay, to her opposite ASIS. Alright, so she is starting in a position of abduction already. Alrighty, she is in 6 degrees of abduction. Alright, so I'm gonna ask her to bring the leg out. Yes or no? Yes?
Mm-hmm.
Okay. Alrighty, so get my landmarks back. Alright. Alright, so on the count of 3, can you slide that leg out for me? Alright, 1, 2, 3, slide it out. Alright, go as far as you can. Okay. Oh, try to keep your toes pointed up if you can.
Oh.
Okay. Thank you. Alrighty, line, check the landmarks again. So bring it back in. So she went to 0, 10, 20, 30, 32. So she started at 6 and she went to 32. So her range is
26.
21. I heard 2 numbers.
26.
26, yeah. All right, 26. Her range is 26. So she started at 6 degrees of abduction. So how would you write that on the board, actually?
6 to 32.
6 to 32, and you're gonna need to be indicative saying starting in an abducted position, right? Because that's her position that she started in, because she just laid her leg down, okay? All right, yes or no? Okay, all right, so for adduction, we're going in the opposite direction now. All right, so can you do me a favor? Come back this way a little bit. Okay. Right, and you're gonna be looking at cross adduction also. Alright, put your leg down. What's gonna get in the way?
My leg.
Your leg. Okay, so she needs to do something with it. Alright, so she could abduct a leg. Alright, can you abduct for me? Alrighty. Is that okay?
Yeah, that's
That
fine.
it's hanging off?
That's fine.
Okay. Alrighty. If it's not comfortable for her, again, you could use the chair, okay, to support herself, okay? Normal range is 30 degrees, okay? So can you just sort of slide your leg out, slide your leg towards the other leg, okay? Go as far as you can. Try not to lift, she just lifted, okay? Try very hard not to lift. Bring it back, all right, to yours, whatever you want position you're starting in. Can you slide again? Okay, good, all righty? And again, what you want to look at, make sure she's not internally rotating now, all right? Kneecap facing up, all right? All right, so I'm gonna place my goniometer. Is this in the way? Is this your
My leg.
other leg in the way, you think?
No, not really. But I feel like it's natural to try to pull them together. Like I
Okay.
feel like I'm using.
Yeah, because it's just a natural feeling
Okay.
people have.
Yeah, it's
Right,
hard to
if
not
you feel
use it.
uncomfortable, do you want to put your leg on the chair?
Yeah, I can try that.
Okay, try that. Okay, and I'll bring the sheet. Okay. Good?
Mhm.
A little bit better? Can you slide your leg out now? Slide your leg towards your other leg. More comfortable? Try not to lift.
Oh.
Okay, try really hard. Now bring it back. Okay? What would I be looking for? Right? No internal rotation of the lower extremity. What else?
Lifting up.
Lifting up, okay? Okay? Keep your backside on the bed and just slide over. Slide over. Good. And bring it back.
What about her toes?
Toes?
You're good.
Yeah, fine. Point up. Alrighty? What I definitely want to see is making sure her kneecap's not turning. Okay? Alrighty? So this is where she sort of landed herself already. And she, just by looking at it, looks adducted already to me. Alright? So I'm going to find her landmarks, okay? Same landmarks. Here's her ASIS. Alright? Her other ASIS. Okay? Midline of the femur. Alright? See what range. She is in 2 degrees of adduction. Alright? So that's already telling me, saying, if she was 6 degrees abducted already, measuring for abduction, and now she's in 2 degrees of adduction, can she reach 0? Yeah,
Yeah.
I could actually put her in 0. But again, I'm measuring whatever range she's starting in, okay? I'm using her resting position. Okay, so on the count of 3, can you just sort of spring your leg towards the other leg, slide it over, okay? 1, 2, 3. Go, 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 go. Alrighty, that's it. Okay. Alrighty. Okay, relax. So she went from 10, 20, 25. So she went 2 degrees of adduction, hip adduction, to 25 degrees of adduction. Her range is 23. Good? Alright. Alright, so looking at passive range of motion now. Alrighty. Supine position is the best position because it's just the most comfortable. Can I do it in prone if I had to? Yeah. But you know what? When you're applying overpressure, that can be something that you want to sort of keep an eye on their face a little bit. So supine is better. Standing, really hard to do. Okay? Don't do it in that position. Alright, so I'm gonna cradle her. Alrighty. She's in a neutral position, so I'm gonna bring her out. Okay. Stabilize her. Alright, and what kind of end feel do you think I would feel? Firm. Alright, and I feel that resistance coming in. Alrighty, and if I go the other way, I gotta switch positions. So, sorry.
It's okay.
Not comfortable. I'm gonna stay here. Alrighty. Alrighty. I'm gonna bring it over this way. Alrighty. For her, she's actually kind of firm. Alrighty. More for the fact, you know, I'm at her end range and I feel a little give. Alright? Alright? What was wrong with my position, by the way?
Reaching.
I was really leaning. I was really leaning.
Maybe would you have her further down the table?
I may have her further down
Or
and
closer
closer
to
to
you.
me, and closer to me, okay? I was really leaning, okay? So again, play with your mechanics. So a couple of you guys, you know, I was looking around and I said, I asked you, are you comfortable? And they go, no. Alright, find a position that's comfortable for you, right? Because depending on your patient, you're gonna need to switch it up a little bit, okay? So you need to sort of find a comfortable position. Alrighty, so for manual muscle testing against gravity, what position for the right hip abductors?
You said what?
Okay, okay, against gravity, right hip abductors, okay? Against gravity position is left sideline, okay,
Oh,
so,
yeah, for her, right.
okay, so right side, are you okay?
Yeah.
Okay. Alright, so. Okay. Come towards me. Yeah, come towards me. Okay, alrighty, are you good? Are you comfortable? Alrighty, so this position here, alright, is this good? Alrighty, she's already done everything for me, okay? She is in a nice position where her trunk is in line with her pelvis, which is in line with her leg. She already has her bottom leg bent, so she can stabilize herself a little bit better. Alrighty, I'm gonna keep her covered this way. Alright, right. Now, can you just lift your leg towards the ceiling in this position for me on the count of 3? 1, 2, 3. Alrighty, and she brings it nice and up. Good range of motion she has. Alrighty, and it was a nice controlled movement, okay? Now, what muscles am I testing here? The abductors, which ones?
Gluteus
Medius and
fasciculata.
yeah, intensive fasciolata. Okay, so I'm testing both of these muscles right now. So you okay? Alrighty, I'm gonna keep an eye on her. I'm gonna use my trunk to help stabilize her. Okay, to make sure she's not doing something weird or anything like that, leaning too much. I'm gonna apply resistance and palpate for the muscles right here. I'm gonna do it through the sheets. Don't do it through the sheets on the practical. Alrighty, so can you just sort of lift up a little bit on the count of 3? 1, 2, 3. Alrighty, and I feel her muscles coming into play. Alrighty, now if I want to add real resistance now, I would be distal, okay, to her hip joint, or basically proximal to her knee joint. Am I going to be interfering a little bit with the tensor fasciolata muscle? Yeah, not much I can do about that, okay? Because I wouldn't want to put resistance here, distal to the knee joint, because at that point, other muscles are gonna come into play. Alrighty, so you wanna be more proximal to it. And at this point, your TFL, it's more junction, it's more tenderness now, okay? Alright, so on the count of 3, I'm gonna apply a little resistance, okay? And you're gonna resist me, okay? Whatever you give me, I'm gonna give back to you, okay, Elizabeth? Alright, 1, 2, 3, go, go, go. Ooh, she's strong. Alrighty, and back down, okay? And back down. Alright, so that is her gluteus medius group, her medius group, and her TFL, okay? Now, if I wanted to test the TFL alone, what position is that? In against gravity position. What would I make her do with her leg?
Bend her knee.
Not a knee, but
Do you flex the hip?
flex the hip,
Yeah.
alright? Sort of take the gluteus medius out of the question a bit, okay? So you would be in this position. I'm gonna go around this way. Alright, so I'll be in front now, okay? And what I want you to, I will bring her closer to me, alright? What I want you to do, okay, so everything's in line, okay? It's only her TFL now. Her TFL, alrighty, is again, when you're looking at the muscles, you have your maximus, medius, and then your TFL here. It's gonna be a little bit more anterior lateral than say lateral itself. Alright, so what I want you to do, can you lift your, keeping your hip in this flex position, this bent position, lift your leg up towards the ceiling again, alright? And bring it back down. And actually I can feel her TFL, it's right under her ASIS. Alright, bring it up one more time, good. And bring it back down. Alright, so she has good range. Alright, I'm gonna add a little resistance now. Where would I put my hand for stabilization possibly? What may she try to do? Rotate her pelvis. So I'm gonna have my hand right here. Alright, and I'm gonna again adjust it as I need it. Alright, so and again, there's not much I can do about the TFL inserting below the knee joint, okay? Alright, so what I'm gonna do, I'm gonna apply a little resistance, and she would be a little bit closer to me. Alrighty, so on the count of 3, bring it up, and I'm just gonna resist you. Whatever you give me, I'm gonna give back to you. So on the count of 3, 1, 2, 3, go, go. Ooh, she's strong. Alright, she's strong. Okay, so she's strong this way. Alright, so for her, definitely 5. 5 out of 5 for her hip abductor people. Okay? Alrighty. So, what position for gravity eliminated?
Supine.
Supine. Okay, can you go supine? Okay. Okay. Alrighty, so, okay, make your legs straight. Okay. Alright. Oh, a couple of you people, when you were practicing, I noticed a lot of you guys were going into a hyperlordotic posture when you were doing hip flexion, alrighty? Yes, to prevent that, alright, what you want to do is to bend the contralateral leg in a hook lying position. Yes, that's okay, because I don't want you guys going into a hyperlordotic position, and you don't want your patients going into a hyperlordotic position. So that's okay. So you guys will see, go back and measure, you're going to notice, oh, wow, I have more range of motion now. Alright, that's okay. Okay, that's okay. Alrighty, so scoot towards me a little bit. Alrighty, alrighty. What, in this position, which primary muscles am I going to be looking at, you think? For hip abduction?
Gluteus medius.
Gluteus medius, okay? And I would be on that side, okay? I am staying over here so you guys can sort of see a little bit better. Alrighty, so can you slide your, come closer this way, so you have enough room to slide your leg out. Can you slowly slide your leg out for me, please? 1, 2, 3. Good. Alright, keep your kneecap facing up, and then bring it back in. Good. Same thing as goniometry before. Okay? Alright, I want to palpate for the muscles now. I'm going to find the greater choke area and be a little bit more posterior to the greater choke. Alright, so on the count of 3, slide it out. 1, 2, 3. Good. And slide it back in. Good. What position would I be in, or she would be in, for hip adductor now.
Slightly abductor.
Yeah, slightly abductor. Same supine position. Scooch that way a little bit. Okay, a little bit more. So you have.
Gonna be on the chair again?
She may need to be. Do you want your leg on the chair?
Actually, it's easier on the two. Because
You
that
better?
chair swivels, so it kind of.
Yeah, it does. That's why we don't use those chairs.
Yeah.
That's why we don't use those chairs. Alrighty. So again, I'm gonna palpate for your muscles, and your muscles that I'm gonna be palpating for is gonna be on the inner thigh. Is that okay with you? Okay, and I will be on the other side, by the way. Alright. So I'm just gonna. Can you just slide it in for me? Alrighty. Go as far as you can. Okay. And bring it back. Alrighty. Is it okay if I put my hands on the inner part of your thigh? So I'm gonna put my hands right here. Alrighty. And can you slide your leg in now? Good. Alrighty, and back. Questions? Same thing as the goniometry before. Okay? Hey, what about TFL? And gravity eliminated. Am I gonna make her keep her leg up here, lift up, and slide it?
Couldn't you support it and then?
I could. It's not the most comfortable thing for me to do, alright? Because even if I'm supporting it, am I gonna be 100% supporting it, you think?
No, not really.
No, because, you know, to be supported like this, they have to be totally relaxed. I'm asking them to lift their leg up with me, and I'll hold it for them, right? And you'll know when you've been doing this for, you know, pretty much like 2.5 months now. When you tell somebody to relax, do they actually relax? No, right? See, when when you did transfers and you told them, relax, I got you, alrighty? In mobility, did they 100% relax? No, it's hard, because, you know, it's not in a person's nature, right? So to make sure, it's not the best thing to do, but it is sort of an easy fix for it. Can you come into long sitting for me? Right? Good.
Are you still
Now,
flexing
can
that?
you go back down onto your elbows? Is that 45 degrees?
Oh.
Yeah, yeah, pretty much. It's an easy fix. Totally easy fix for this, okay? Because I created a 45-degree hip angle by just bringing her trunk up. Alrighty? So you can ask them to go into long sit first, or if they just know what pop means, pop up on your elbows. Alright? Either way. Alright? So, you know what? We'll go with that leg. Come towards me a little bit. Just a drop. Alright? Go here. Okay. Alright. Alright. Same TFL muscle, and you're gonna see a difference here. Alright? Slide your leg out. Alright? Since she's flexing already, it's more of her TFL now that's coming into play. Alright? Not so much her glute med. One more time. Good. And bring it back in. And what I'm gonna be looking out for is any trunk rotation of the foot, anything like that. Questions? Okay. Okay. Let's do internal and external rotation of goniometry. What do we do with the goniometry stuff? There it is. Okay. Why don't you sit up and face them? Okay. Okay. It's a little chair now?
The blue one?
Yeah, a little blue guy. Okay. Remember when we used the Electronon process to measure the shoulder internal and external rotation? Alright, because there was just no way of aligning the acromion process. Alrighty, to
So
the
we're gonna
hip
use the
joint.
patella.
Yeah, we're gonna use the patella. Now looking at this, depending on the person's muscle mass, you may or may not need a towel roll, right? To make sure the patella, the apex of the patella is in line with the hip joint, okay? So, I'm gonna see, okay? Right, just so, the apex of the patella, is it on the top part
Bottom.
or the bottom? Bottom. Okay, so I'm gonna find the apex of the patella. Her patella sort of sticks out, which is really easy for us. Alrighty, and yeah, she needs one small towel. Okay, and lift up. Down, a little bit better. Okay, a little bit better. So what I'm gonna do, so her fulcrum is gonna be in line with her apex of the patella. Her proximal arm line can be parallel to the table or perpendicular to the floor, whichever one happens to work with you. Right? I like perpendicular to the floor because everything's starting in one position. Right? But both of them works the same way. Alrighty? Now her moving arm is going to be in line with the tibial crest. A tibial crest, tibial crest. Alrighty? Is that sharp edge, alright, that's going down the front part of her tibia bone, okay? So here, some people are a little bit more prominent than the other, and it's gonna go straight down, okay? Alrighty, now, can you just sort of, Elizabeth, keeping your leg on the towel, okay? Can you just turn your right leg out like that for me? Okay? What is that? Internal rotation. Even though she went out laterally, look at what the hip is doing. Okay? She went internal. Okay?
Yeah, because this is external. Yeah, makes sense.
Okay, so make sure you don't look at the leg. Don't look at the leg or the foot, the lower leg. Look at what the hip is doing. Okay? Alrighty. So can you do that one more time slowly for me? Do that motion? Alright. Okay, gives me an idea.
And the knee kind of goes with it too.
Mm-hmm. Can you turn your bottom of the leg towards the other foot for me? Okay? True, try not to lift as best as you can. Okay?
My leg is getting big.
Okay?
I feel like I could go further than that.
Okay? She feels like she could go further than that. Alright, what would you tell her to do? Well, don't do that. Right, she could do that. Most
Everybody
patients
can.
can't do that. Just tell her to abduct. Alright, get it out of the way. Because her leg did get in the way. Alrighty? So just sort of tell her to abduct her leg. Can you go point your bottom of your foot outwards again? Alright, gives me an idea. Okay? Can't you point the bottom of your foot inward now towards the other leg? Try not to lift, remember. Okay? Good. Good job. So I can see exactly what she's gonna have already, doing that actively. Now I'm gonna line it up and I'm gonna go do internal rotation first. Right, line up with the apex of the patella. Alrighty. Alrighty, I'm lining up to the perpendicular on the floor. And she is basically starting at 0. Alright, so I'm gonna give my goniometer a head start. I'm gonna take it apart a little bit so I can see. I'm gonna pull it away. Now on the count of 3, point your bottom of your foot towards the outside again. 1, 2, 3. Good. All right. Take it away. She is 25 degrees of internal rotation. All right. Line her back up. All righty. She's still at 0. I'm going to take it away. All right. On the count of 3, bring your bottom of your foot towards the other foot. 1, 2, 3. Keeping everything. Try to keep that foot on the bed, leg on the bed.
Doesn't even know what that is.
Alrighty. 10, 20, 30, 40, 45 degrees. Alright, she has 45 degrees. So she went from, what was it, 25 to 0 to 45. Alright, so on your notes here, you would write hip internal, external rotation. 25, 0, 45. Alright, if you write hip external, internal, 45, 0, 25. Okay, so there's a definite distinction. Yes or no?
Mm-hmm.
Okay. Okay. For manual muscle testing, okay?
Can you repeat the range of motion, how you have to write it?
She went to from 0 to 25 for internal and 0 to 45 for external. Because remember, look at the hip. Don't look at this thing, okay? Alright, so if I write it in one thing, if I write hip internal, external rotation,
25.
25, 0, 45. If I write hip external, internal rotation, 45, 0, 25, okay? So there will be no mistakes in it, okay? All right,
Taking
again,
the two into account.
yeah. Again, you can write it separately also, all right? Hip internal rotation, 0 to 25. Hip external rotation, 0 to 45, all right? Again, different methods of writing, documenting goniometry, okay? Yes or no? Okie dokie. Alrighty, so your internal and external rotators, okay? Thinking it of the plane of motion. Are they against gravity? When do you say internally and externally rotate? When you tell your patient, turn your leg in, turn your leg out. Are they sort of in the plane of gravity at all?
In what position?
Kind of.
And they'll say, just like this position.
It kind of seems like it.
Just
No,
that-
the muscle isn't.
The muscle isn't.
But the leg is, and the motion,
Oh.
think about that, okay? Yes, I'm making it happen because, this is the position I'm measuring everything in. But the motion itself is still not really against gravity, alrighty? And not going into gravity. It's sort of like in the plane of the horizon again, alrighty? So again, looking at this when you're doing manual muscle testing, right, look at the definitions, what they mean, and then, you know, there may be some liberty taken in with the actual grading itself, right? Because these motions are occurring in the horizontal plane, yes or no? Right, so, alrighty, so if I am gonna do external rotation, okay, do a manual muscle testing for external rotation, alrighty, we already know the motion, right? What is she gonna do? Which way is her foot pointing? Inward, alrighty? What may she do to try to compensate?
No.
Laterally flex
Laterally flex, which way though?
to the right.
Yeah, probably to the right if she's on her right side, okay? Alrighty?
Oh, so I was right.
Like
Yeah.
this.
Yeah, probably laterally, okay? Alright, because she's going this way, she's gonna go, ooh, I wanna go. Alright, make it go. Alrighty, what else will she do? She did it already.
I lifted.
You lifted her leg, okay? She started using her sartorius muscle. Alrighty? Alright, so I need to be aware of where I sort of wanna stabilize her. Alright, so if I'm gonna apply resistance eventually, I am gonna be somewhere on this side. Alrighty? Now, if I need to move my hand from the trunk, from her pelvis, trunk area, to a shoulder area, I can do it in one fell swoop, okay? Hey, don't do that, alrighty? And I'm gonna be applying resistance, okay? Where do you think I would be applying resistance?
Proximal ankle.
Yeah, probably proximal ankle. That's probably the easiest way to do it, okay? And I'm gonna just tell her, sit straight, okay, sit in a nice upright position. I'm gonna want you to turn your foot towards the inside of the other leg now. Remember, don't lift up your leg, alrighty, and don't twist your trunk or bend your trunk, okay? Alright, so I want you to support yourself here, okay? You can support yourself on the other side too. Alright, I'm gonna put my hand right here, is that okay? Alright, when they're doing that, make sure they're not going into trunk extension, alright? As long as they're not going into trunk extension, they're okay. Alrighty, so on the count of 3, can you do that motion one more time for me? 1, 2, 3, alrighty, alright, didn't apply resistance yet. Alrighty, so I can see how much she's gonna go. I'm gonna put my hand here, stabilize here, keep an eye on her. 1, 2, 3, go, 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 go. Ooh, and she's strong here too. Not as strong as she was in her abductors, but she's strong here too. And you're gonna wanna tell them, go slow, so I could get that resistance in. Yes or no? Okay?
She went super fast.
Yeah, she went super fast. Okay? Alrighty, so you want to instruct them, go slow. Slowly bring your leg up in that direction, alright? And I'm gonna resist the motion. Alright? So where would I be standing if I wanna check internal rotation now? Yeah, I'll be over here somewhere. I'll be over here somewhere. Alrighty. Okay. Alright, what may she try to do to compensate? Okay. She'll lean into the opposite direction, contralateral direction. Alrighty. Some people do, every once in a while you see them lean forward, pulling their abs to do it for them. Some of them might try to do that. Alrighty. So again, your hand is gonna be sort of at the ready. Where do I need to tell them to stop moving? Okay, so I'm just gonna put my hand here. Alright, can you sort of bring that leg up again one more time towards the outside? Good. Alrighty, and I can feel her stabilizing, by the way. I feel her shaking a little bit because she's stabilizing. She's self-stabilizing herself. Alright, so if I'm gonna add resistance now. Alright, I'm gonna squat a little bit, put my hand right here, keep an eye on her. Now this time I want you to do it again. I'm gonna add a little resistance. Alrighty, go slow. Alrighty, and whatever you give me, I'm gonna give back. Ready? On the count of 3. 1, 2, 3. Go, 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 and relax. Yes or no?
Yeah.
Alrighty. Now with the palpation part of it, you can possibly palpate for internal rotation because you'll get some of the tensor fascia lata and the glute min possibly. But for your external rotators, alright, remember those guys?
Sisters and brothers.
Yeah, the sisters and brothers.
The Gemellis.
Alright, the Gemelli brothers and the obturator sisters.
Yeah.
Okay, they're very deep. They're covered by everything else. Okay, so it's going to be really hard for you to palpate everything. Okay, alrighty. So it's just difficult, at least in this position.
They're palpatable though, right?
It's a task that
Probably-
I'm not going to show you. It's a practice task. It's a very practice.
Probably
task.
depends on the
And
composition of
Yeah,
body composition
yeah, oh
of the
yeah.
person.
It also depends on the body composition. Okay, they're the deepest muscles. They're right before you get to the joint capsule. Right, so they are hard to palpate. Okay, Eddie. So what position would she be in for gravity eliminated?
For
Supine.
external?
For internal and external rotation.
Oh, bro.
Supine?
Oh, gravity limited.
Gravity eliminated.
Supine.
Supine. In supine position. All right. Okay. So can you go supine, please? All right. We'll do her right leg so you guys can see. Alrighty. Now, really easy. Alright, you comfortable?
Yeah.
Okay. Alrighty, you know what? Scooch down a little bit to me so we could get your heel off the bed a little bit. Okay, right there. Right there is good. Alright, want the pillow? Pillow can come.
Should I?
It's up to you.
I mean,
Yeah, you can keep the pillow. She can keep this leg, non-testing leg, contralateral leg bent or extended. It's whatever she wants comfortably. Alrighty. So if I am gonna have her, it's not the most accurate test in the whole world, especially when you're talking with rotation here. Alright, because you'll see why in a minute. If I'm gonna test for external rotation, what position would her leg be in if she's staying supine? You think? Would she be internally rotated? So can you sort of turn your leg in like that? Alright, oh, that's all? Oh yeah, because she didn't really have that much good range. Alrighty, what I'm gonna ask you to do, can you turn your leg all the way out now? Alright, go ahead. There you go. What happens halfway through?
She bends her knee.
She bent her knee. Okay, so you want to keep your leg straight. And what else? So turn your leg in again. Oop, what you doing? Now try not to do that. I'll stand over here. Alright, I'm gonna stabilize you with my hand here. Alrighty, so she doesn't lift her pelvis up. Now turn your leg out, all the way. And did gravity take over at one point?
Yeah.
Yeah.
She's going into it.
She's going into gravity. So it's like I said, it's not the most accurate test in the whole world because you are actually letting gravity take over at that point. Because people will naturally flop in. So if this is for external rotation, for internal rotation, she's starting in an externally rotated position. So is this as far as you can go? Yeah, okay. Now turn your leg all the way in now. Go, 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 go. All right. And she doesn't have that much, okay? So this is the position. It's like I said, it's not the most accurate position, but this will give you a general idea, all right? By the way, what do you think is stronger, by the way? People's external rotators or internal rotators, you think? External. Usually people's external rotators are stronger because you're using that muscle to pivot,
Yeah.
okay? That's your pivoting muscle, okay? Questions?
so you're not palpating?
It's hard. You can't. It's going to be very difficult to palpate them. Like if I really wanted to take a look at the tensor fascia lata, right, I would do the hip abduction in a flex position to look at the tensor fascia lata. Okay, that's what internal rotation is. The muscle is performed by the muscles that we can get a better sense of doing other things. Yes or no?
Yes.
Alright, external rotators are just too deep. Okay? Alright, so why don't you guys continue practicing for the next few minutes because I am waiting for the other two people, okay? To come in, alright? Okay, so go ahead.